you know, an immigrant who speaks very little English shows up in a health practitioner's office, there's a challenge. How am I going to actually understand what this person's health needs are, what their health status is, and what their health needs are? One of the things that's important is to help that practitioner by providing them with, you know, some kind of a previously done screening that says these are the issues. This is this person's health status. This is their understanding of how to maintain their health. So, you know, it's a big complex area, but it should be a high priority because it actually costs us money. The immigrant who comes in who is not, you know, able to maintain their health, they can't work as well as they would like to and as we would like them to. They pay fewer taxes, you know, and they end up, you know, overall, I mean, there is a cost we can calculate for not doing this, and it's not a small amount, it's a large amount.
And what about the complexity of just handling tests and referrals in a clinic that doesn't have a trained medical receptionist or trained medical secretary or trained permanent staff? I just think that that's something that is, as a management, something that's so often underestimated in our program. I just wondered if you know, if you've had to deal with this, and I know it's not all pretty.
But as a matter of fact, this referrals and finding providers to the newcomers, new families, it's like been like a very big problem. It was like really complex. It was more than I imagined, and because I never worked in this field before, like finding providers or like referring patients. So when I started to do that, it was like it's not only the referring, it's finding the right place to refer the patient to. Sometimes we send referrals and we don't get a reply for like 2 or 3 months, and when we get the replies, it's like for another 6 to 8, 9 months waiting. So it was like a very big hassle. So people need to appreciate what the medical receptionists really do, because it's really a hassle. Well, we always try to find that. For example, we were lucky for finding some physicians who speak the same language or from the same cultural background for some families. But if I want to put a percentage for that, it's like only 2 or 3%. So it's really hard to find someone who speaks the same language and from the same background and live in the vicinity of the new immigrants. So it's really hard. And this brings us to another problem, is like finding interpreters. Even if we are lucky to find a provider to a family who speaks in a different language, so we have to find an interpreter to go for the interviews and the medical appointments. And that's another problem too, because we faced this problem before. There was like some breach of confidentiality because the interpreter was not trained well. Even if they are really trained, sometimes some information just disappeared in the three-way communication.
And also, we have to understand the health refugees issue is one of the puzzle related to the settlement integration. You know that the settlement integration is a big puzzle, and then we always look at the education, look about employment, look about housing, look how to make these people feel welcome, but we miss that puzzle. This puzzle that link the refugees that just arrived to the Canadian health system, which is based on the preventive.
Over the time, for the past few years, because many more immigrants are coming, and maybe it's not a large number, but it's a good number of immigrants who are coming with either serious medical needs or some medical needs. And so one of the initial priorities is how can I find a family doctor, where can I find it, or where can I go when I get sick. And so there is a lot of burden in our programs to try to deal with the healthcare providers community when we call them and they don't accept new patients.